Hi, I'm Paola Hernandez Jayo. Welcome to today's episode of Together San Diego. Thank you very much for joining us. Our guest today is Roberto Alcantar, Chief Strategy Officer of Chicano Federation and spokesperson for the San Diego Latino Health Coalition. Welcome, Roberto. How are you?
I'm doing really well. Thank you for having us today, Paula.
Thank you for joining us. I know the San Diego Latino Health Coalition is doing a great effort in San Diego, in particular with the Latino community as it has to do with COVID-19. Can you tell us about this, please?
Definitely. So the San Diego Latino Health Coalition is a group of nonprofits, community-based organizations throughout San Diego County that came together to really make use of the established network that we have, and also the fact that we are seen as trusted messengers throughout the community. And so what we've been doing for months now is working on the ground level with our most affected communities, particularly the Latino community, which we know was hit extremely hard by COVID, with over 60% of cases being in the Latino community. Nearly half of the deaths of COVID are in the Latino community. And so we've been out in the community talking to folks, providing them with the right information, making sure that they have all the tools necessary to make the best decisions for their families and themselves. And so this includes, providing facts about, testing, about COVID and how to keep themselves safe, information about the vaccine, but also, COVID-19 safety kits, which were these kits that we've given out thousands and thousands throughout the community, in partnership with our other community organizations, even, local cities like the city of Chula Vista, city of San Diego, city of National City. And these kits provided folks with reusable masks, disposable face masks, digital thermometers, and a wealth of information for the community to make use of during this difficult time.
I know you've been doing great work in our community, and you have a number of organizations, nonprofit organizations that you've been partnering with, and there's 4 organizations that are lead. Which one are the 4 lead organizations on the project?
Yeah, so those 4 lead organizations in the project are San Ysidro Health, South Bay Community Services, MAAC, and the Chicano Federation. And so as the 4 leads, what we've done is we've established these resource centers throughout San Diego County. So for example, MAAC has a resource center that helps the community in North County. We, the Chicano Federation, are in more of central San Diego, and then you have South County, which is South Bay Community Service and San Ysidro Health. And so folks can basically call any of these resource centers and get all sorts of information, whether it was a COVID-19 safety kit, questions about, the vaccine, getting help with getting a vaccine appointment, getting help locating a testing site, but also, anything else that they may need aside from those specific COVID-19 things. So, for example, some folks need access to affordable housing. Chicano Federation does offer affordable housing, so does MAAC. And so what we try to do is build this network of, community-based organizations, and we have a referral system where we refer folks to the resource centers based on their zip code, but also based on the resources that they're looking for, since these 4 organizations offer similar resources, but also some very specialized resources. So, what we're doing is trying to get folks to the best location possible to make sure that their needs are met.
It's also important to mention that you offer services in multiple languages.
Definitely. So one of the things that was really important for us as a San Diego Latino Health Coalition was to make sure that not only that we get the information to the community as best as possible, but that we also make sure that information is translated in Spanish. And we're not talking about Google Translate. We're talking about Spanish that is spoken locally. We call it Español Fronterizo. It's a Spanish that is local, that folks really understand and can relate to. And that's really what our focus has been, because a lot of folks, came to us and said, at the beginning of this pandemic, they said, we don't know where to find information. Some of this information doesn't make sense to us, or, we want information in Spanish that is culturally relevant to us. Right. And so that's the work that we've been doing. And then we have a model of promotoras who are out in the community having that communication with folks in English and in Spanish, to make sure that they're getting the right information and making the best decisions for their community.
You came up with a campaign called Con Orgullo, which means with pride. Tell us about this campaign and also how it translates into our community, why it was important to have a specific campaign for the Latino community.
One of the things that we were seeing in our community was that folks were really nervous about, getting tested because of the, to be honest, a lot of it has to do with the economic pressures that a lot of folks in our communities don't have the luxury of working from home. The Latino community is overrepresented in these high contact, high risk, low paying, essential jobs. And so folks were saying, I don't want to get tested because if I came up positive, I'm not going to be able to take time off of work, or I'm going to get fired, or all these, different things. So what we were doing is we're providing people with the information, letting them know what their rights are during this pandemic, and reminding them that this is, even if they're feeling well, it's not just about us as individuals, but rather as about our community as a whole. And so, we thought about how our community is very proud of who we are. We're very proud of our culture, of our contributions to this country, and we talk about it with pride. And so that's where that came from, was this idea of we have to do this collectively with pride for our communities, con orgullo. So we do this, we launch this campaign about, con orgullo, which is with pride for our communities, for all of us. And that's the only way that we're going to be able to recover from this crisis, if we all of us take care of each other and we do it with pride for our community.
Now you're moving on to helping with information about vaccines. Tell us about the campaign that you're doing and the tactics that the coalition is using to try to increase vaccination.
So, again, one of the things that, we were faced with is the fact that within our communities, there's a lot of skepticism. There's a lot of skepticism about the vaccine for multiple reasons. One is a lack of trust with local government, and rightly so. We've seen our community feel that local government is something that they can't trust because of interactions with immigration enforcement. We do have a lot of families that are mixed status families, referrals to law enforcement, issues like that they've seen in the past. The other is, just the lack of information. When folks were not getting the information, in front of them, or accurate information, they turned to social media, they turned to the neighbors. And so there was a lot of rumors and misinformation out there. And then also, there's a history of communities of color, being used, to test different types of medications, vaccinations with negative effects. And so there's a lot of history there that leads to that skepticism that we see today. So what we've done is we've partnered with the County of San Diego to do a pilot project where we're actually the ones talking to the community directly and having these reserved slots for vaccines, so that we can get those eligible folks within the Latino community registered for their appointment and vaccinated. So it's a lot of information that we give out. It's a big process to walk folks through this thing, but it's very important for us to do. And so we're also, we've also implemented a promotora model where we have folks out in the community distributing information to folks, letting them know about the vaccine, because we want to make sure that folks feel comfortable with their decision, and they feel that they're equipped with all the tools necessary to make the best decisions for themselves and their families.
Talking about information, Roberto, where can folks find information? I know you have a website. I know there's also social media, a phone number where they can call for more information and for services.
Yeah, so our website is the best place to go. It's sdlatinohealth.org. That is the best place to go to get all sorts of information. We list, testing sites. You can get, see what kind of resources we offer. But if you'd rather call, we also have that option. And our number is 619-285-5600. There you can get all sorts of information. We can help you get an appointment to get vaccinated. If you need any supplies or anything to take care of yourself, such as, we have KN95 masks that we're giving out to the community, because we know that we have a lot of essential workers, in our community who need, a lot of face masks for every day at work. So, we're here to provide that help. So call us, go to the website. You can contact us through the website. You can give us a call. We're here to help. And if we don't have the resource that you're looking for, we will refer you to one of our partners who will have that resource for you. So please call us. If you have any questions, we're here to help.
Also, you can visit them on social media at SD Latino Health on Facebook, where they also post information on the most recent events. Something else you would like to add, Roberto?
One of the things too that we do there is we provide community engagement sessions that you can watch, that we've done throughout the last couple of months, and they're still up on our social media, so you can watch those. But it's been a lot of work, and there's a lot of challenges that we face within the Latino community. But our goal is to remind folks that they have to take care of themselves. We have to do everything that for our communities, but also looking forward and reminding our leaders that we need equity and recovery. This recovery is going to take a while for these communities that are most afflicted. And so we'll be working with our local leadership to also look at policy making that will make this, the recovery more equitable for our communities.
Thank you very much, Roberto. Thank you to you and the Chicano Federation and the San Diego Latino Health Coalition for the great effort and work you're doing in our community. To close our segment for today, we're going to leave you with a video of the wonderful work that the San Diego Latino Health Coalition and the Chicano Federation are doing in our community. I want to thank you today for watching Together San Diego. You may watch more of our episodes at san diego uniontribune.com/togethersdlive. Have a good day, everyone. Thank you for watching.
I am passionate about helping families. When COVID-19 reached San Diego, we knew that this was going to impact our community very deeply, and so we wanted to work right away. We've done at least 2 distributions of essential supplies every single month. We have provided rent relief, flexible financial assistance. We've done distributions of diapers. We've done distributions of COVID-19 kits and PPE. During a time where our community was struggling and really needed support, I was really grateful for the assistance and the partnership of the San Diego Union-Tribune. Not only did they help us to raise funds to be able to better serve our community, they reached out and offered to be a partner and really asked, how can we help? And we were able, in a matter of 6 months, to be able to distribute more than 20,000 COVID-19 safety kits. I'm grateful to live in a community that has been so responsive and so supportive.